Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I can't speak. We're going to be doing a Kahoot, and we're going to be covering pregnancy risks and complications. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There you will find so many great resources to help you along your nursing education journey. Again, that website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here on YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Pregnancy-related risks and disorders. Okay, what is the most important intervention to reduce HIV transmission during pregnancy? Is it to encourage a vaginal delivery? Is it to administer antiretroviral therapy? Is it to recommend breastfeeding? Or is it to provide IV fluids? What do you guys think? Your live is not eligible for recommendation and restricted in results because it contains unoriginal and reproduced content. They do this every single time. I made up this Kahoot. Give me a second, guys. Maybe because it's a Kahoot. Okay. Okay, very good. You're going to administer antiretroviral therapy. That is going to be the best thing to reduce transmission. Look at your other options. Encourage vaginal delivery. No, vaginal delivery actually increases risk of transmission. So that's wrong. Recommend breastfeeding. No, breastfeeding is contraindicated in the woman that's HIV positive. That increases the risk of transmission. So that's wrong. Provide IV fluids. Well, providing IV fluids is not contraindicated. It's actually a supportive measure, but that has nothing to do with the transmission of HIV. And so that's why the only correct answer here is administering antiretroviral agents. Which finding is most consistent with chorioamnionitis? Is it bradycardia, decreased fetal movement, maternal fever and uterine tenderness, or hypertension? Mal, congratulations on passing your boards. Congratulations. Chorioamnionitis. What clinical manifestations would we expect to see? Very good. Wow, I see what's close between blue and yellow. Most of you guys chose yellow. Very good. Maternal fever and uterine tenderness. So, what are we seeing? What is chorioamnionitis? This is basically infection of the amniotic fluid, right? And so we'd expect to see the mom to have fever. We'd expect to see uterine tenderness. We expect to see those signs and symptoms of infection. Look at the wrong answer choices, bradycardia. If the patient had chorioamnionitis, we would see the opposite. We wouldn't see bradycardia. We'd see what? Tachycardia. You need to know that. Decreased fetal movement. That can occur, but that's not specific to that infection of the amniotic sac or amniotic fluid. And then last, hypertension. No, that's not a related symptom with this disorder. Which maternal condition is linked to fetal macrosomia and neonatal hypoglycemia? Would it be ectopic pregnancy? Would it be preeclampsia? Would it be endometritis? Or would it be diabetes mellitus? What do you guys think on the live? Very good. Congratulations to all the new grads. All right, diabetes mellitus. That is the correct answer. So, macrosomia, neonatal hypoglycemia. What's happening here, guys, is mom's diabetic and there's too much insulin that's being produced, and so what happens is the fetus and the baby ends up being larger than normal and hypoglycemic. So when mom has gestational diabetes, you need to make sure that you're regularly checking the patient's blood glucose. Okay, now ectopic pregnancy, what's that? That's pregnancy outside of the uterus. Preeclampsia, we'd see the opposite. We wouldn't see the macrosomia. If anything, we would see intrauterine growth restriction. That baby would be smaller than normal. Okay. And endometritis, that's infection, and that's a postpartum infection. Make sure you guys know, guys, these wrong answer choices that I'm going over, make sure you know them as well, because you may not see the gestational diabetes. If you're taking maternity right now, yeah, that's going to be a test question. You're going to see it. However, these other options that are incorrect, you may see that as a test question. So make sure you know all of them. Which sign supports a diagnosis of DIC? Disseminated intravascular coagulation. Would it be bradycardia? Would it be warm, dry skin? Would it be bleeding from IV site? Or would it be hypertension? Which sign supports the diagnosis of DIC? Very good. Bleeding from the IV site. So what's happening? All of the coagulation factors, they're being consumed, and so this patient's going to be at risk for bleeding, right? First one, bradycardia. No. If anything, that patient's bleeding, what are we going to see? We're going to see the heart rate go up, not down. Next, warm, dry skin. Well, no, if anything, that patient's losing blood, they're at risk for shock. Their skin would be what? Cool and clammy, not warm and dry. So that's warm. That's wrong. And then hypertension, nope. If that patient's bleeding and they're losing blood, would the blood pressure go up or would it go down? It'd go down. They're losing blood. So the correct answer is bleeding from IV sites. And guys, you see how I'm explaining to you why the right answer is the right answer and the wrong answer is the wrong answer? The way that I'm thinking, all of that is pathology. If you can do well in patho, if you like are taking your prereqs right now, you're not in the nursing program. If you don't listen to anything else that I tell you, please listen to this. Take patho seriously, because if you can understand the pathology, there are lots of questions that you're going to get right simply because you understand patho. Take it very seriously. Make sure you know it. Don't just take it as a class to check off to get into the nursing program, because it's going to come back to haunt you. All right, what is the nurse's priority for a patient with ectopic pregnancy? Would it be morning sickness? Would it be weight loss? Would it be fetal heart tones? Or would it be risk of rupture and hemorrhage? Congratulations, Jess. Very good. Risk of rupture and hemorrhage. Even if you didn't know what ectopic pregnancy was, which I already explained to you, okay, it's pregnancy outside of the uterus, but let's say you didn't know what it was. Take an educated guess. How you take an educated guess? A question is asking you what your priority is going to be, it's always going to be something that will either kill your patient the fastest or keep them alive the longest. It's going to be one of those two things. So when you look at these options, even if you didn't know what ectopic pregnancy was, you still should have went with risk of rupture and hemorrhage. Why? That's the deadliest thing. Organ rupture, any organ, that's always a medical emergency. Always, every day of the week. Okay? Which is most concerning in suspected endometritis? Would it be pink lochia? Would it be foul smelling discharge and fever? Would it be breast engorgement? Or would it be decreased appetite? Which is most concerning in a patient that is suspected to have endometritis? Thank you, Noella Braids. You guys are awesome. I didn't think I was going to have this many people on the live. It's only 11 a.m. All right. Foul smelling discharge and fever. This is most deadly, guys. So, what are we dealing with? This is a uterine infection. Pink lochia, that's normal. Why would we be concerned about that? Breast engorgement, number one, that's not deadly. And number two, we're talking about the uterus being infected. And decreased appetite, who cares? Who cares about decreased appetite when the patient's got an infected uterus? We're going to be concerned about that infection. What is a classic sign of Hydatidiform mole? Is it back pain, fetal bradycardia, spotting in early pregnancy, excessive nausea, and large uterus? So, guys, I'm going to be off for the next 3 months. I take the summers off. I'm not seeing any students. However, I'm still going to try my best to the videos that I release on YouTube every Sunday. Those will still be released. I'll be at different locations, but I'll still get that information to you. Okay. All right, guys. The correct answer is excessive nausea and large uterus. Wow, most of you guys went with spotting in early pregnancy. Spotting can happen, but it's not a classic sign. A classic sign is that patient having excessive nausea, them being nauseous all the time, and having a large uterus. Now, here's what's so crazy. They have these symptoms of pregnancy. They have nausea, they have a large uterus, but guess what? That's not a true fetus that's in their tummy, is it? No. So, hydatidiform mole, you have clumps of pregnancy cells, but is it viable? Absolutely not. Okay. Make sure you go. That's right. Adri says they have high HCG levels. They absolutely do. However, it's not a true pregnancy. They're just pregnancy cells that are clumped together, but it's not a true pregnancy. It is not viable. What is the primary concern in hyperemesis gravidarum? Would it be weight gain? Would it be pelvic pain? Would it be risk for dehydration and electrolyte imbalance? Or would it be increased fetal activity? What would be a priority in the patient with hyperemesis gravidarum? Okay, very good. Risk for dehydration and electrolyte imbalance. So hyperemesis gravidarum, that's where the pregnant woman just keeps, she's very nauseous. And so she keeps throwing up and throwing up and throwing up and throwing up. And it puts her at risk for metabolic alkalosis because all that acid that's in her tummy, in her stomach, that's supposed to be breaking down the food is coming out through the vomit, right? And so it also puts her at risk for dehydration and electrolyte imbalance. Now, guess what? Before I started recording on the live, guys, I was telling the student who was taking their exit exam those three things to write down um, when they get their scrap piece of paper before testing. What are those three things? You need to write down ABC, you need to write down the nursing process, and the third thing you need to write down is Maslow's. And when I say Maslow's, I want you to think of physiological integrity. What is going to kill your patient the fastest or keep them alive the longest? And when I was going over that list, didn't I say fluid electrolytes? Yes. Fluid electrolyte imbalance, dehydration, hypoglycemia, change in cognition, respiratory dysfunction, cardiac dysfunction, anything that the patient cannot live without, right? Or will kill them the fastest. That will change that patient's physiological integrity. Seizures, chest pain, the list goes on. You guys know what I'm talking about. It's very important when you're stuck between those two questions, always go back to those three things I said to you, and most of the time you'll be able to figure it out. I digress. A patient with preeclampsia has a seizure. What's the priority action? Are you going to start blood transfusion? Are you going to administer magnesium sulfate? Are you going to check dilation or prepare for epidural? So this patient who had preeclampsia is now in eclampsia. They had the seizure. What is going to be your priority action? How many questions do I have? I think 10. I think there are 10 slides, if I'm not mistaken. Okay, yep. You're going to administer magnesium sulfate. Absolutely. Here's the thing, and I say this a million times because this is a famous test question. It's been a famous test question for over 20 years. It's not going to change. When it comes to mag sulfate, we are not giving the mag sulfate to decrease the patient's blood pressure. So the patient that has preeclampsia, guess what? There's so many better drugs on the market, so many antihypertensive agents that will bring down the blood pressure without those horrible adverse effects. We will never give mag sulfate for blood pressure. Now, does max sulfate bring down the blood pressure? Absolutely, but that's never going to be an indication. We're going to give max sulfate. We're going to give max sulfate for the seizure. Okay, bringing down that blood pressure is just a wonderful side effect. So anyway, patient has a seizure. What you're going to do? Patient has a seizure, you're going to make sure you ease them to the ground safely. You're going to turn them onto the left side because you want to decrease the risk for aspiration. You're going to turn them to the left side before you put that pillow under their head. That's very important. Make sure you remember that. You're going to make sure that you give the patient oxygen. You're going to suction them as needed. Safety. Okay? Absolutely, you're going to time that seizure. You know it. That patient has that seizure as you're easing them to the ground. You're looking at the clock because you need to know what time that seizure started. And then after that patient stops seizing, you need to look at that clock again so you can know when it ended because that's one of the things you have to report to the healthcare provider, the duration of the seizure. That's a big deal. Knowing the duration of the seizure, that information is going to be used in the treatment plan after the patient has had the seizure. That's right. Nothing by mouth, NPO. Okay. I think this is, yep, last one. What is the hallmark symptom of placenta previa? Severe abdominal pain, dark malodorous discharge, bright red painless vaginal bleeding, or elevated blood pressure? What is the hallmark symptom of placenta previa? My cheat sheet is not available for the public yet, but you'll be able to find it on my website once it's available. It should be available within the next few weeks. Okay, so the hallmark symptom for placenta previa, it is bright red, painless vaginal bleeding. Very good. Now, severe abdominal bleeding, that would be what? Placental abruption. So placenta previa, guys, this is where the placenta implants abnormally. And so implants in the lower part of the uterus, so it can cause partial obstruction or full obstruction of the cervical os, right? So severe abdominal pain, that's not placenta previa, that's placental abruption. You need to know the difference between the two. Dark, malodorous discharge, that would be infection. And elevated blood pressure, that would be what? That's related to preeclampsia. But when it comes to bright red, painless, not painful, painless bleeding, you should be thinking of placenta previa. And guys, that is it for this Kahoot. Someone on the live was asking about my cheat sheet. I got the green screen on, so you really can't see it. However, this is my NCLEX and Gen cheat sheet, volume 1 and volume 2. That's going to be available to the public within the next couple weeks. So just keep checking my website. As soon as I get the green light from my attorneys, it's going to be posted and ready for sale. Website nexusnursinginstitute.com. Just keep checking. Trust me, guys, I want this out before you do. All right, guys, thank you so much for watching. Don't forget, you guys can find me covering nursing topics almost daily on my social media platforms such as TikTok, Instagram, Facebook, and of course, YouTube. My handle is the same everywhere, Nexus Nursing. All right, let's see how you guys did.